The views expressed in this podcast do not reflect those of our training institutions or the APA. The information discussed is for educational purposes only and should not be used for diagnosis or treatment. Hello, and welcome to the American Journal of Psychiatry Residence Journal podcast. I'm Blake Novy, psychiatry resident from the Mayo Clinic and also one of the media editors. This is for education, and I have no financial interest to disclose. I'd like to welcome our guest, Dr. Akeem Sule.
All right, Blake, let's do this.
Dr. Sule is a consultant psychiatrist at Essex Partnership University NHS Foundation Trust, as well as an affiliated educator and honorary visiting research associate with Cambridge University. He's originally from Nigeria, where he did his medical education at Ogun State University Teaching Hospital, followed by specialist psychiatry training with the Oxford Rotational Scheme. He and Dr. Becky Inkster both co-founded Hip Hop Psych, a social venture aimed at bridging the gap between the hip-hop community and the medical community. Some of their notable publications include The Lancet Psychiatry in 2015 with Kendrick Lamar, Street Poet of Mental Health, as well as the 2020 British Medical Journal article, How Hip-Hop's Progressive Narratives Are Helping to Tackle Mental Health Stigma. While preparing for this interview, you jokingly mentioned how it felt like I was Dr. Dre cooking up the beats before you stepped into the booth like Tupac. I'm so excited to have you on the podcast, so let's get to it. So, starting off, I wanted to ask you, how did you come up with the concept of integrating hip-hop and psychiatry?
Okay, so I guess I've always been a hip-hop fan. I would say I've been in the game since 1979. I've been a fan. As a young boy, I had an elder sister who used to play music. I remember, basically Sugar Hill Gang, Rapper's Delight. And then you think about Houdini and the early acts of hip hop, Curtis Blow, so I've always been interested in the genre. But basically, having listened to hip hop for a number of years, I remember when I was doing my residency at Oxford, and I just wanted something to pique the interest of the medical students. Because as I'm sure you can appreciate, Blake, a lot of the medical students, then they wanted to be glorious surgeons or anything but psychiatry. And I found that by looking at hip hop lyrics, by bringing some of, these issues into the lectures, it piqued their interest. And what was very interesting was that was when I met the co-founder of Hip Hop Psych, which, is our initiative to explore hip hop lyrics and look at mental health themes and use it for psychoeducation. So I told Dr. Becky Inkster, who is a neuroscientist, about what we do, and the rest is history.
That's amazing, because I know residents, medical students, psychiatrists, we all have these different aspects about ourselves that we're really passionate about. And it's inspiring to see how you took these two seemingly disparate concepts and fused them together.
I think let's think about where hip hop began, because I think you've got to look at the origins. Now, the traditional view you would say is that, it started from South Bronx, but I'm biased. I'm African. And what Becky and I for Hip Hop Psych, we always emphasize and the honest truth is it started in Africa. In Africa, you had the griots. I am a Nigerian. I'm Yoruba. We have this thing called Oriki, which is oral tradition. So people basically used to describe their family's tradition, their life history. But let's look at how tradition was taken through slavery, through the Caribbeans, and then in South Bronx. And what was happening in South Bronx in the 70s through Reaganomics. We had that whole thing about fractured families, decimation of Black Panthers, and basically all that turmoil within South Bronx, lots of drugs. And so if hip hop is the CNN for Black folk, like Chuck D described it, then if you examine hip hop lyrics, you would see elements of those vulnerabilities towards mental health problems, which I've mentioned. But you also see resilience, because we see where hip hop is at the moment. We see the Jay-Z's, the Babies. We've seen, multi-million industries. And so if we look at the lyrics, we see both the vulnerabilities as well as resilience factors. And so I think that an authentic form of popular culture like hip hop can inform on mental health problems. We just need to look at the themes, really.
That's great. I like how you bring resilience into it. And at the same time, you're also talking about music being a mirror to the culture, and in particular, Black culture.
Mm.
It seems like hip hop is a way of looking at something larger than just a musical genre.
No, I do agree. I mean, we have to remember, I think what's happening now is, and hip hop scholar Tricia Rose mentioned this. We had this hip hop studies conference about how of recent people are trying to globalize hip hop, and that's a good thing. But it has to start from the origins from Black folk. And yes, there were Latinos involved, but predominantly Black culture. Because no one would say like opera. No one would say opera is global. We know about the Italian origins. You understand? So I think when you look at the history of Black folk and you look at the pain and the suffering, when you look at structural racism, you understand, that is told in those stories. That being said, it's now globalized, but there's something about hip hop that taps into every different culture. So people, yes, bring their cultures into it and can basically tell their truth. Because I think as human beings, we can relate to things like pain, suffering, we can identify, we can see how that impacts on mental health problems. So I do think there's space for both. There's space for recognizing it as a predominantly Black art form, and I think that should be recognized, but also being aware that other people bring their experiences. So, for example, talking about my experience, yes, I'm Black, but, you know, I am from Nigeria. Now, my experience will be different to, say, someone of African Caribbean origin, or what we define as Black British, or an African American. And that's because, for example, I grew up in a predominantly Black society. I came to the UK when, you know, much later in life. And so my experiences will be different from someone growing up here. So, for example, my kids, their experience of being Black British, they're used to the pressure of me telling them, like, you're going to have to work 5 times harder than your white folk. My son is fed up of hearing it, but that is the truth. You know, it's something I would tell him. So his experience is different to mine. I've not had that pressure on me. So just bringing all these different aspects means, you know, we can have a candid discussion about human experiences.
Absolutely. And, over the last several years, we've had an increased visibility of social injustice, racism, and inequity across minority groups. In America in particular, the field of psychiatry is a pretty checkered past of structural racism. What are some of the ways that people such as myself and other residents and psychiatrists can promote mental health and equity across other minority groups?
Okay. Well, the thing is, that's a loaded question. So, Blake, and it's a pet interest of mine. I think generally something like this is helpful, but for me, I like to describe it as there are few records out there. So if we're making parallels to hip hop or movies like Spike Lee, movies like Do the Right Thing, some of the articles that I've really felt influenced by. So there was an American Journal of Psychiatry article. I call this to me, it's a to pimp a butterfly moment. And it's by Deirdre Anglin. It's entitled From Womb to Neighborhood, a racial analysis of social determinants of psychosis in the United States. It's by Deirdre Anglin and her colleagues. And I think it's a really, really great summary of how we can look at structural racism from things like prenatal factors up until neighborhood disparity, structural racism, and how these impacts on psychosis. And I think there's a wider discussion to be had there, you understand? Another article I found really helpful is by Okpemipo Akirele and Gary Aragan and Madison McCall, and it's called Healing Ethno-Racial Trauma in Black Communities. And this is in JAMA Psychiatry, 2021. And it really talks about cultural humility as a driver of innovation. So what's cultural humility? That is your ability to step back, to be self-reflective, to try and understand the culture of an ethnic minority, and to basically look at your own role, because we all have biases. And I've given you the example, for example, Blake, that even me as an African man, there's some things I cannot understand, or I would need to be open and humble enough to understand the experiences of what it's like to experience Jim Crow, or for a Black British who's experienced racism from when they were young to adulthood. I've not had that experience. I've grown up with predominantly Black folk. So being humble about that, being able to learn. And obviously, there's been mention of white fragility. And I think sometimes when that is mentioned, people become really, really difficult. It's like, oh, are the culture wars here? Are people trying to bring the critical race theory? And if you want to look at work that would help, there's some work by Jessica Isom where she talks about how we can have these conversations where people aren't felt under threat. But the honest truth is, even if you feel under threat, the question is asking yourself why. As psychiatrists, we need to look at social determinants, because public health, affects mental health. Those neighborhoods, those racial policies. I give you an example. You might have seen the recent, there was a recent JAMA pediatrics paper, I believe it was by Steph Stoll, where they spoke about having a ground zero approach to exploring the increased risk of suicide among Black youth. Before it was assumed, well, Black folk are extremely resilient, which, given the years of slavery and social injustices, we've had to be. But of recent, particularly between 2008 and 2018, increased suicide, particularly between the age of 5 years to 17 years, and apparently less than 12 years, the suicide death rate is about 2 times higher among Black children than white. And the question is, why? Why is that happening? Now, if people are curious, just having a broad brush universal screening approach doesn't work. But being humble enough to look at what's happening, could this be due to what we're seeing with like Black viral death, particularly when we look at people like Trayvon Martin, people like Tamir Rice, who are young folk, and Black people are exposed to this over and over again. And that article really explored that, really, you understand? So I really do think it's about being open, cultural humility, and also working with those communities, being prepared to work in different ways, whether that is the barbershop, whether that is churches. In my work in the UK, we've had to have discussions with churches because sometimes Black folk aren't going to basically come through traditional areas. One of the things I've been quite interested in is we have an association here in the UK called Black Psychiatrists Association. And we've recently set up a film club because film is something which I think is really a way of looking at, Black mental health or, racial trauma and having that open discussion. And of recent, we've seen, people like Ava DuVernay and Spike Lee getting their flowers. And so, these conversations are opening up.
Yeah, I'm really glad that's the case. And of course, I'm always excited to talk more about movies. In terms of film and music, how do you see these forms of art and culture informing the way that you practice psychiatry?
Okay, wow. Okay, Blake, I could go on, me. I could spit bars for days on this. Okay, yes. So let's see. What I want to do is give you examples like on the word. So what I've tended to do is I've always been interested in music. So I'm always interested in the music my patients listen to. I think the advantage with hip hop is it's the new pop culture. So I can remember an example where we had this chap suffering from schizophrenia. He wasn't really opening up much. And I had this resident doctor with me. So we're trying to ask him questions the traditional way, nothing. Then I noticed he's wearing these fly white basketball Adidas shorts, a fly white Adidas top. And he's got the Adidas trainer, we say trainers in the UK, but sneakers with no shoelaces in, with the tongues up. And I'm like, I see you. And sometimes I use the lingo. I'm like, I see you rocking those Adidas. And then we got on to music. And the next thing is like, can I spit a bar for you? And I'm not joking, Blake. This guy raps, and all the psychopathology you want as a psychiatrist was in the rap. And there was the resident doctor like, oh, it's not sin. I'm like, wow. And he basically told me his story through the services and about the despair. And I was like, okay, that's really sad. And then he's like, oh, I've got another one. And then he spoke about his resilience. And once we did that, the conversation opened. Another example I can give you is like with film. You know, I'm a big fan of film. Look at things like The Wire, for example. I mean, Bubbles. If you've not watched The Wire, you know, you've not had a training, a psychiatric training. But Bubbles' navigation through the services gives you a typical example of what Prochaska and De Clemente called the cycle of change. You see Bubbles on his journey to recovery through the pre-contemplation stage, contemplation stage, action stage, and maintenance stage. You see him having lapses. You see his guilt. You see the increased risk for suicide. And you see that on the inside is someone who is a good person, really. And again, Blake, I know I'm drifting about, but let's look at, for example, what happened with George Floyd and how within the media he was portrayed as an addict. Because when he was killed, isn't it unfortunate that people try to use his opiate addiction and dependence against him, you know? And I would challenge people to say, you know, if he was white, let's look at painkiller addiction, which has happened in predominantly, you know, white areas, you know, how much you know, in terms of, you know, it's been seen as an illness, you know, rather than being, you know, bandied as criminality. But when we look at the crack addiction, looked at what happened. So in summary, I've tended to use these films. Like I asked them, what film have you watched? I asked them, have you seen this? Another good movie that I like is The Five Bloods by Spike Lee. It's on Netflix. And that's such a fantastic film about post-traumatic stress disorder. One of the characters there has post-traumatic stress disorder. And you see everything from the hyper-arousal, hyper-vigilance, the avoidance, the flashbacks. And sometimes having these conversations with patients, it does open it up, especially when they're interested in film. And I think it's asking them if they're interested in film. And if you've watched the film, recommending films and asking them, are they interested in it and what they think about it? So I think it opens the conversations. And I think the patients, you know, they see you as a human being. And I also think it flattens the hierarchy. So it actually deepens rapport with your patients.
I love that. Mm-hmm. And it also gives me an excuse to watch more movies and say that I'm doing it for training.
Absolutely.
So basically, you know, if we take anything away, it's that you should watch more movies to be a better psychiatrist.
Absolutely, yes. You know, the traditional ones, as good as you get, you know, people would mention that, you know, but also it's what happens with hip hop is what happens in film as well. You understand? You know how before movies were tagged black movies, but when you look at a movie like or a documentary like Ava DuVernay, The 13th, you find out if it's made well, it appeals to everyone. There, like I said, elements human experiences, suffering, and so on. As people become more open, you can tap into those things, if that makes sense.
Yeah, and speaking of being more open, I wanted to talk with you about the idea of self-disclosure for artists.
Yeah. Okay, you got me. Yeah, let's do this.
So looking at the content of lyrics, there's this concern about the contagion effect, particularly when artists are rapping about topics like depression or suicide or substance use. But then on the other hand, you also have the anti-stigma effect, like in Logic's 1-800-273-8255, which introduced listeners to the suicide hotline. What are your thoughts on these aspects of self-disclosure?
Okay, Blake. So Becca and I, we wrote on this in our BMJ paper, which is British Medical Journal. So please check that out. That was like one of the first hip hop articles in the British Medical Journal. But self-disclosure has always been present in hip hop. It's just how it was coded. So if we look at the message, there's reference to suicide there. My favorite MC of all time, Tupac Shakur, shed so many tears. You know, he's talking about depression and trauma from losing, his homies to the cemetery, like Tupac would say. Ghetto boys, my mind's playing tricks on me. I mean, that you're talking about, hallucinations, you're talking about delusions, you're talking about grandiosity, you understand? But when we start seeing, changes, a new wave of artists emerge. The Kanye West, who was saying, look, that gangster lifestyle and stuff, I have moments when I cry. 808 Heartbreak. Kid Cudi, Man on the Moon, where they're talking about more emotions. Up until now, we have a genre of hip hop called emo rap. So those would be the XXXTentacions, the Juice WRLDs, where they're more open, the Little Peeps. So probably more of Little Peep. Now, I think generally, I think it's about the intention, because sometimes, people will listen to it and say, these lyrics mean a lot. You've helped me to have a better understanding of what I feel when I'm depressed. But then again, we know there's the danger of contagion. It's really difficult to know how it's going to go, because that will depend on the vulnerability of the individual. So for some, it might be helpful. For others, they might be vulnerable. But I always say it always depends on how it is done. And I remember recently, what's his name? Machine Gun Kelly actually spoke about how he felt some of the new wave artists are trying to commodify depression and suicide and make money off it. So I think it obviously has to be done in a responsible manner. I think, yes, you can discuss about it, but there needs to be some responsibility. And I guess we as psychiatrists, we can use the lyrics and ask, how did it make you feel? Did it make you vulnerable? And also to discuss the contagion effects, really.
Speaking of using lyrics, what are some other ways that we as psychiatrists can use art to help treat patients?
To be honest, generally, like I said, it's basically asking them if they have interest, seeing our patients as whole people. So if someone wants to paint, okay, do you want to paint something? Bring it to the ward review. I'm saying this as an inpatient consultant. What does it mean? How does it help you? Do you want to tell us about it? How does painting help you? Just being curious. I mean, for example, because I like music a lot, I might ask some of my patients, I'm into hip hop, why are you into country? And people forget with country is a lot similar to hip hop, Country has some dark themes, when they're talking about Mary J, they code it, you understand? But they also talk about drug addictions, they talk about incest and all that. For example, in the UK now, they have this thing called social prescribing. So people with like chronic mental health problems, you can go to your primary care practitioner and he puts you in touch with a social prescriber. So it might be that you get someone, if you're interested in going to museums and that's good for your mental health, they take you to a museum. If you're interested in going to art galleries, if you're interested in going to like open green spaces, that basically can be, can be very, very helpful. Now, I know I'm talking beyond the arts now, but it's about just basically being creative, about those things. So I think it can help because it helps with resilience. It helps with people's coping strategies. It helps to relax them, and sometimes people speak better in certain environments. So sometimes we wonder as psychiatrists why a patient is revealing more to the occupational therapist than to us, because the occupational therapist has taken them for a walk in the garden. They're more relaxed, or they're having a music session and more stuff comes up. So we basically have to be a bit more flexible as well in terms of our approaches. And engaging with the arts is one way we can do that.
Wow, I love that. Kind of along similar lines, as a resident, I'm pretty new to psychotherapy, and I was wondering, how do you integrate some of these concepts that we've been talking about into psychotherapy?
Okay. So I guess generally, there is hip hop therapy, you understand, where people use hip hop, themes. So that is there. You can read stuff on it. I can talk about what we do in Hip Hop Psych. We're more interested in psychoeducation. So we analyze lyrics. You can see our articles in Lancet Psychiatry on Kendrick Lamar. What we do is also on our website. It is clear. But in terms of things, in the UK, Blacks are less likely to be offered psychotherapy. The uptake by Black folk, it tends to be less. There might be a number of reasons, maybe mental health stigma, maybe when we look at a lot of these therapies, the white folk and maybe Black folk don't think they can understand their experiences. And so again, the cultural humility needs to be there. But certainly, like say something like hip hop, if you're getting some young person who might be interested in hip hop and he doesn't want to talk much, sometimes you could play. There's this thing called emotional anchoring, where you could play, maybe like if he's interested in Tupac, when Tupac goes back in elementary, I thrived on misery. You understand? So you could ask, how was that lyric? How did it hit you? How did you feel? So basically getting him to describe how he felt on that. And certainly with hip hop, you get that. You understand? In Kendrick Lamar's track, You, where he's depressed, you see all kinds of cognitive distortions there. You understand? You can use that. And also there's this concept called positive visual imagery. And Becky and I wrote about this in one of our hip hop psych papers. But basically, positive visual imagery is when people are depressed. Sometimes you get them to build a narrative which is positive, where if everything goes right, what do you see of yourself in 5 years' time? Okay, tell me what you're sitting, what's the grass like and stuff. Hip hop does that. When people are like talking about the models they've not yet dated, the bottles of Moe they haven't yet popped. What are they building? They're building a rich narrative. When people like, Maino, and we wrote about this, when Maino goes, when I think of my life, I envision Ferraris and Obama, you understand? All these kind of things, positive visual imagery can be used because hip hop tends to be very visual and aspirational. Obviously, there needs to be a balance there. I'm not saying all it's good because you can also argue that is where your emo hip hop comes. If you're building negative visual imagery, what impact does that have on your mental health? So again, I think it's about basically being creative. And also with films as well. So I'll give an example. In Treatment, I don't know if you ever watched that series. That was a good series on, if you want, I would say for any resident doctor, watch In Treatment. I think it was an HBO series on a private psychotherapist. And what's interesting, you just see the way he's sucked in. It shows the good, the bad of therapy, where he's basically sucked into having a relationship with a patient and, the transference, counter-transference issues going on. And I think sometimes showing a patient a movie and saying, okay, this is what the movie portrayed, but this is what's incorrect in the movie. Sometimes you have like movies. What was the one with, what's his name? Russell Crowe.
A Beautiful Mind.
Was it A Beautiful Mind? Yeah. So, having those kinds of discussions and saying, okay, what do you relate? Is there any similarities? What's not similar? You understand? Because often when people think about schizophrenia, sometimes they focus a lot because of a movie like that. They think it's a lot about visual hallucination. So it's having those discussions. Yeah, it's having those discussions. And that's why film, like I know, Blake, I'm interested in my hip hop, but film can also be so powerful,
I can't tell you how long it took me to break that idea, The longest time after seeing that movie and the portrayal of John Nash as a schizophrenic, I assumed visual hallucinations were like the linchpin of schizophrenia.
Yeah.
And then I went to medical school and residency training, and it turns out it's actually the auditory hallucinations. Anytime a person asks, visual hallucinations, what do you think of? In my mind, I'm like, A Beautiful Mind. But in reality, it's probably substance use or encephalitis.
Yes, absolutely.
That makes me think about, growing up watching movies, at least from my own experience, that was my introduction to the idea of mental illness. I'm a big fan of horror films, but, at the same time, I'm also against the negative portrayal of psychiatric patients as frightening, and I think that can be really harmful.
Yeah. What do you think about the film of the Joker? Because that was really interesting. How it portrayed, because there was that whole overlap. Was it pseudobulbar? Do you understand? Was it upper motor? Neurology meets psychiatry, the pathological laughter. There were all kinds of things, but I sometimes think that even a negative portrayal, having that discussion with your patient, what do you think? Is this what you see? Are you aware that this is what's not correct? This is what's correct. This is having those discussions really, can be really important.
What would be your recommendation to residents that are excited to train, but also trying to find their voice?
Yes. I'll just keep it simple. Do you? I think sometimes with our residency programs, you take some of the brightest minds, and I'm not saying no disrespect to other specialties, but what I'm saying is we beat it all out of them with guidelines and algorithms. And I just say particularly with psychiatry, just do you. You're interested in music. Just because you're a psychiatrist, it doesn't mean you can't be interested in music. You want to play the violin? All these things, all these human experiences will help you to be would help you to be a better psychiatrist.
No, I love that. Your passion about everything you do, it's very inspiring.
Thank you.
It helps fuel me as I'm going through the thick of residency. And I think seeing how you've maintained your identity and your sense of self while furthering the field of psychiatry, it's just very inspiring. And I think it's something that we can all work towards.
Okay. Can a shameless plug, Blake? Can I give my Twitter handle? Would that be okay?
Absolutely.
So it's at AK411CAM. So AK411, as in what's the 411? Mary J. Blige. At AK411CAM, CAM. That's my Twitter handle. And our Hip Hop Psych website has got all our details, Twitter handle, YouTube. It's hiphopsych.co.uk. And Hip Hop Psych is HIPHOPPSYCH. So there are two P's next to each other, and our Twitter handle is at HIPHOPSYCH. So with the Twitter handle, it's just one P. A bit confusing, but rappers will be flipping stuff, so. Yes.
Thank you so much, Dr. Sule. I really appreciate you taking time to come onto our podcast, and it was great talking with you.
Thank you.
We appreciate all the listeners out there for listening to the American Journal of Psychiatry Residence Journal podcast. If you have any comments or suggestions, feel free to reach out to us on social media. You can follow us at AJP_ResJournal on Twitter and AJP Residence Journal on Facebook and Instagram. If you enjoyed listening, consider dropping a 5-star rating for the podcast. Don't forget to click subscribe, as we have exciting new interviews in the pipeline. Until next time.